Family, Seniors, and Health. We're going to go ahead and start with a hearing for Senate Bill 726 with Senator Henderson. Begin when you're ready.
Thank you, Chairman and committee members. For the record, Senator Mike Henderson from the 3rd Senatorial District, here to present Senate Bill 726. Many of you know, because of some of the meth problems that we had years ago, methamphetamine, that we restricted the sale of Sudafed. And so what this bill does, it seeks to increase the annual allowable purchase limits of behind-the-counter Sudafed from 43.2 grams to 61.2 grams. Over a decade ago, Missouri joined many other states that limited the annual purchase of Sudafed to combat the growing use of manufacturing of meth. Since that time, the program has been very effective. Since that time, we've cut it back 99%, over 25,000 labs at that time to under 100. We know a lot of them have gone to fentanyl. That's not a good thing, but meth isn't the drug of choice that they have right now. This increase in purchase limits brings Missouri in line with surrounding states while leaving in place common sense limits. It allows an equivalent of 8-month annual supply of Sudafed for those who suffer from allergies like I'm probably doing right now, because I kind of suffer with that myself in the springtime, like many of us. This also supports the NPLEX system. This bill seeks to require any drug manufacturer selling Sudafed in the state of Missouri to pay fees for the purpose of supporting the National Precursor Log-In Exchange used by Missouri since 2017. Basically, this is trying to make sure that we're keeping track of this Sudafed so we don't end up in the situation we were in about 10 years ago once again. While I'm happy to answer any questions, I also have an expert here that would be happy to explain in any details about the bill. And with that, I'll take any questions.
Thank you, Senator. Any questions for the Senator? Seeing none, why don't we go ahead and pause just for a second and before your witness comes up, and we'll just go ahead and call the roll and establish a quorum.
Senator Brattin. Senator Hudson.
Here.
Senator Carter.
Here.
Senator Nicola.
Here.
Senator Lewis. Senator Nuremberg.
All right, thank you. Okay, go ahead. First witness, begin when you're ready.
Thank you, Madam Chair, and members of the committee. My name is Carlos Gutierrez. I'm Vice President of State Government Affairs for the Consumer Healthcare Products Association in Washington, D.C., and we represent the makers of over-the-counter medications, dietary supplements, and over-the-counter medical devices here in strong support of Senate Bill 726. Thank you to Senator Henderson for bringing it forward, and you, Madam Chair, for providing it a hearing today. That Senator Henderson did a really good job of laying it out. You know, this bill does two primary things that we think are very critical. Number one, it does increase over-the-counter access to these medications by consumers here in the state of Missouri. And number two, it solidifies the viability of the NPLEX system, which governs the sale of pseudoephedrine not only in Missouri, but 37 other states. So in terms of, in case you don't know, by the way, pseudoephedrine is what we're talking about. It's the active ingredient found in many cough, cold, and allergy medications: Sudafed, Allegra D, Claritin D, Zyrtec D, etc. It's placed behind the counter. You're limited on how much you can buy per day and per month by the federal government. And Missouri does go a little bit further and also has an annual cap, and that's what this bill will be addressing. So again, federally, there is no annual limit. Missouri does have one that's 43.2. That is the most restrictive in the country, and this would just bring it up a little bit to provide for the two allergy seasons, so an 8.5-month supply for an individual like myself, as you can probably tell from my voice today, that has seasonal allergies. The other part of this that we think is really important is the NPLEX system. So when Missouri adopted this bill or this law, 6 manufacturers pay for the system. They do so voluntarily. We think that's appropriate. We're not trying to skirt that responsibility. What has happened, though, is that there have been new market entrants. So new manufacturers have joined or have started selling this product, but they're not paying for their product. So what's happening is the existing manufacturers are paying not only for the sales of their products, but also about 20% of the market that is not theirs. And so all this bill does is says, if you sell into the state of Missouri, then you are responsible for paying the fees associated with your product. And the way that works is manufacturers pay on a monthly basis on a per box fee, so that the NPLEX system can block people who may be buying it illegally. So that's it in a nutshell. I'd be happy to try to answer any questions. Thank you.
All right, thank you for the explanation. Any questions for the witness? Seeing none. Thank you for your testimony. Anyone else here to testify in favor of the bill?
Madam Chair, members of the committee, Nikki Strong here on behalf of Haleon. I want to go on record in support of this. You've seen me here before on the underlying piece of this bill, changing the annual limit. We also support the additional piece, the NPLEX system, that is in Senate Bill 26. We are one of the companies, one of the manufacturers who actually pay that fee, and we think that if we pay the fee, everyone should share in and pay in the fee as well. So I'd be happy to answer any questions.
Thank you. Any questions for the witness? Seeing none, thank you for your testimony. Anyone else here to testify in favor? Seeing none, anyone here to test in opposition? Seeing none, anyone for informational purposes only? All right. Any closing comments, Senator?
No, thank you very much.
All right, thank you. All right, with that, we're going to go to Senator Brattin's bill. Senate Bill 662. Begin when you're ready, Senator.
Good morning, Madam Chairman, members of the committee. For the record, Senator Rick Brattin, Senator for the 31st Senatorial District, Cass, Johnson, and Bates County. I have before you Senate Bill 662. Basically, what this bill would do, it would limit the capability of purchase of through SNAP of the purchase of soft drinks and of candy through SNAP. You know, this is one of those programs, I believe, that has gotten out of hand, gotten out of control. The capability of what can be purchased through this program and the potential detriment of health and well-being of the entire population is the last thing I think that the taxpayer should be having to aid and fund that aspect. Now, just on the more narrowly tailored on the sugar aspect of it, sugar, the increase of the sugar intake from Americans back from basically the inception of food stamp program to begin with has gone up to about 300% of the daily value of what we consume. We consume 300% more than any other nation on the planet. We're one of the most obese nations on the face of this earth. Heart disease, obesity are one of the leading contributors of death. We've seen since just 1999 a 243% increase in deaths just due to obesity and heart disease. And sugar is probably one of the biggest contributors to those factors. You know, I honestly would love to see this taken further. I think, and I've actually sponsored bills that have taken it further. I think these sorts of programs, it's in the name, Supplemental Nutrition Assistance Program. It's not supposed to be, and it wasn't intended to be a program to purchase everything under the sun. High processed foods and all these sugary foods that lead to these massive costs and health situations that we're also paying the bill for. Heart disease, you name it, has increased exponentially. And the fact that the taxpayers are spending all this money on a program that's actually fitting the bill for these sorts of foods, I think is just preposterous. I've seen, let's see, there's a study done by NIH that says that we spend an average just on obesity, and we've seen an increase in obesity of 75%. Let me mind you, since they've basically brought food stamps onto the scene, of $147 to $210 billion a year just on that healthcare costs alone. And again, with taxpayers fitting the bill for the health aspect of it and the healthcare costs, and then we're also subsidizing the purchase of these foods, I think is just outrageous. This does piggyback on the Make America Healthy Again initiative by Robert Kennedy. I think this is one of those things. It's a small step, but I think it's a massive step. My wife is a breast cancer survivor, and that's one of the things through her treatment was the caution to stay away from sugary foods. Well, if the number one purchase of food stamps is soda and it's all this candy and all this nonsense, what do we think we're doing to the health and well-being of these next generations? I think it's just a terrible policy, and this is just a small crumb that we can do to help right the ship, because I believe it's gotten way out of control. So I know you're going to hear that this puts us at a competitive disadvantage, and we're going to hear about the bottom line. But the real bottom line is, what are we going to do about the health and well-being of America? I mean, it's quite clear where we've gone and where we're at today. And I just think we've got to look at the high processed foods. We got to look at the sugar, the amount of sugar intake, and do everything we possibly can. And if it's through a program like this, then we need to do it. I don't want to filibuster the bill, but this is one of those things that I really, truly feel strongly about. And I hate to see us subsidizing a program like this with these sorts of food products. So be happy to answer any questions.
Just a comment, we've had several senators that have tried to do even just a minor food labeling in transparency, and the amount of pushback is just atrocious, in my opinion. The access to good food and healthy food, even when you're trying to eat healthy, is a hurdle to overcome when you're being very intentional. So I appreciate you bringing the bill forward. And
to piggyback on that, I mean, we hear that, well, there's no access to this or we don't have the money for it. Well, if we're all spending money and the number one food product is soda, if we're spending all the money on those things we shouldn't be eating, well, of course you're not going to have the money to purchase those sorts of foods. So
yeah, no, but it just in general, right? Just
yeah, absolutely.
The whole access is part of, and that education is part of access and helping people to be able to make better choices. So I appreciate, like I said.
Thank you.
Any comments or questions? Go ahead.
Thank you, Madam Chair. Good morning, Senator.
Morning.
I first want to start just by saying I really do appreciate some of your opening comments. I am also very concerned about nutrition and making sure that we're doing everything possible to have healthy foods available to families, especially those experiencing food insecurity. I don't know the stats from across the state. I'm sure there's folks here that can share this, but I know in my district, 1 out of every 6 kids lives in a home that is food insecure. So I have the privilege of serving on a board called Feed Northland Kids, and part of that work is so important. I don't think any of us want to think that any kid in our district is going to bed hungry at night or going through their cupboards just hoping that there's something in the back of their cupboards, right? But unfortunately, that's the reality for far too many families. And so I'm grateful that there are programs like SNAP to make sure that families can help do whatever they can to make ends meet and provide that food for their kids. So I want to start by saying I truly do appreciate the intent of making sure that that we're doing everything we can to get nutritious food to families, at the same time doing what we can to combat obesity. When I looked at your bill, and I think obviously we see this as a movement across the nation right now, I think there's a lot of good intentions behind it again. The issues that I see in the bill is really when it comes down to definitions. And there are so much that, when we look at just the definition of candy, and I just want to take some time on this if we can. So preparation of sugar, honey, other natural artificial sweeteners, right? So we can have any sort of combination of chocolate, fruit, nuts, in the form of a bar. Senator, would this include granola bars?
I don't know, and I don't believe that it would, just due to the I guess percentage. I would say it's a higher percentage of a healthier food product more than the sugar content. But if we need to shore it up in any way, shape, or form, I'm happy and would love to do so. Because,
Yeah.
granola bars and stuff like that, I definitely don't want to get them encompassed in here. But I also, just because a Baby Ruth has peanuts in it doesn't mean that it's a
Sure.
nutritional
No, I
item.
think that's
So that's
fair.
what.
And I was just thinking, and obviously you're a dad, and you know the struggle with young kids, right?
Yeah.
As you're running out the door in the morning. So it's if I can get my kids to eat a Nutri-Grain bar, sometimes that's a win, getting to school on time, right? A Nutri-Grain bar, a granola bar, etc. And so I just want to make sure that we are really intentional as we look at these definitions, because I think that's where we're going to run into a lot of struggles. When I was looking at the definition of soft drinks, again, very, very broad. So even something like, if we can hone in, if it's honing in on the sugar content, for example, even something like Pedialyte, obviously is the whole purpose of Pedialyte, right? If a kid's dehydrated and you're trying to supplement, it's chock full of sweeteners. I mean, that's the whole purpose of it. And so, again, just those are the conversations I'd really like to have moving forward. I know this bill didn't get out of committee in the House because of those very concerns. So I'm sure we're going to hear a lot of those today. But I want to say that this is something that I hope we can be intentional on working on. Again, I share your concerns about making sure that our kids have access to nutritious food. But at the same time, I don't want to put unnecessary burdens where all of a sudden we're cutting off a huge chunk of food that really is making sure that kids don't go hungry.
Yeah.
Okay.
Thank you.
Appreciate it. Thank you, Madam Chair.
Any other questions for the witness, for the senator?
Senator, I just want to thank you, too, for bringing this bill up and bringing it to our attention as well. And thanks for convicting me severely since my office had donuts this morning. So thank you very much. Appreciate it.
All right, any other questions? Seeing none, thank you, Senator, for your presentation. We'll begin with those here to testify in favor. Anyone here to testify in favor?
Chairwoman Carter, members of the committee, thank you for the opportunity to speak this morning. My name is Greg Pfister, and I'm here today on behalf of FGA Action. FGA Action is a nonprofit, nonpartisan advocacy organization that seeks to improve lives by advocating for public policies based on the principles of free enterprise, individual liberty, and a limited accountable government. I'm here today in support of Senate Bill 662, a bill that promotes accountability and will help make Missourians healthier. I want to start by saying that I'm not here to pick a fight about soda or candy or any one item. That's not what this is about. I think we all know that if we get too focused on one example, we might miss the bigger picture. The fact is that SNAP, the Supplemental Nutrition Assistance Program, or food stamps, is funded with taxpayer dollars and meant to help people get the food that they need. The law says the purpose is to help families afford a more nutritious diet and fight hunger and malnutrition. That's the mission. And I think that most folks, regardless of where you sit politically, can agree that if that's the purpose, then the program should reflect that. So the question isn't, should someone be allowed to buy a soda? The question is, does the program still line up with what it was created to do? If it does, then great. If it doesn't, then let's be honest about it and make some adjustments. It's not about being punitive. It's about being responsible. And it's about making sure that the program does what it says it's going to do. We owe it to the families who rely on SNAP and to the taxpayers who fund it to keep that purpose front and center. Senate Bill 662 accomplishes this in a reasonable way. It's a win for health, it's a win for common sense, and it's a win for Missouri. For those reasons, I ask you to support Senate Bill 662. Thank you again, Madam Chair, and I'm happy to answer any questions.
Thank you. Any questions? Go ahead, Brett.
Thank you, Madam Chair. Thank you for being here. Appreciate your testimony. I think this is a great idea. Appreciate Senator Brattin's work on this. And I've been, this idea has been floating around the Capitol for a little bit, as it's already been mentioned. The discussion has taken place on the House side. And I appreciate that you mentioned in your comments that something that's very important, and that is that this program is funded by tax dollars. I think if we were to conduct a poll, certainly in my district or folks throughout the state of Missouri, many individuals would believe that there are some inappropriate uses of tax dollars with regard to certain items. We want to help folks out all that we can. We want to do what is right, but at the same time, as I said, there's some things that it's just an inappropriate use of tax dollars when we're paying for those items. And one of those things is junk food. Now, we've talked a little bit about the definition and how you're going to define that. I would like you, if you could, to speak to, is this legal? Because that's something that I've kind of heard in this building. How can we do this in a legal way, not run into any problems with regard to USDA or anything like that?
Senator, that's a great question. And what we've seen in the last several months as states have been working through sessions and governors have been digesting this issue is a pretty significant movement across the country of states working on this reform and governors issuing executive orders in support of it. Just last week, actually on Tuesday, Governor Sarah Huckabee Sanders had USDA Secretary Brooke Rollins in Little Rock to announce the submission of the waiver there. Also in Indiana, Governor Braun had RFK Jr. and Dr. Oz in the Capitol to announce that he was going to be submitting a similar waiver. And Idaho Governor Brad Little signed a House bill that would require the state to submit a waiver. So far this session, we've seen in 6 instances states that have either announced or have actually followed through with filing a waiver across the country, along with a couple dozen states that are still working through the process of passing this reform. The fact that the USDA Secretary Brooke Rollins has been championing this in states and RFK Jr., I think lends to the fact that this is something that the Trump administration is asking for from states. And it's a good reminder that, of course, this waiver will be going to the USDA, where Brooke Rollins has the authority to act on it. Current statute gives USDA the authority to define what food is allowed and not allowed in the program. And so really what Senate Bill 662 does is just ask USDA to use that authority to give Missouri a waiver to remove that food that doesn't have nutritional value.
Very good. So this is a conversation that's taking place not only in the state of Missouri, but throughout the country, at least in
Yes,
many
Senator.
areas here. Okay. Thank you for that clarification. I think this is a conversation we need to have, and I appreciate your testimony. Thank you, Madam Chair.
Any other questions for the witness? I have one question. So do we need to, if this definition is left up to the USDA, is there a need to really hash out what does that look like? What does the waiver look like when you're telling us that at the federal level, they kind of define what that looks like? So just wondering if the state has to be as concerned about the definitions, or they need to be more concerned about the process with the waiver.
Yes, Madam Chair, what the bill does is sets up the parameters for the conversation with USDA. So Missouri doesn't need to sit there and go through individual items to figure out what will be banned and what will be accepted. Really what the waiver does is it sets up the guardrails for that conversation. And then USDA will make the determination as to what items will be banned, what will be allowed, and how Missouri will be able to move forward.
Okay, great. And then just one other question. What is it does look like there's other states that have applied for the waiver. Is there a time limit? What's the terrain looking like for those states that have already applied for a waiver?
Yes, Madam Chair. So most of the action from states has been in the last handful of weeks. So the states are Arkansas, Indiana, Idaho, Nebraska, West Virginia, and Utah. I believe that Arkansas is the first state that has actually submitted the waiver. And so we're still waiting to see kind of how long USDA is going to take to act on it. I'd say that the exact timeline isn't known, just because we haven't had an example where a state has been approved yet,
Okay,
just
great.
because of the fact that it's only just been submitted.
Gotcha. Thank you. It looks like Indiana has also submitted a waiver.
Yes,
is what
ma'am,
I'm
that's
being
correct.
told. So we have Arkansas and Indiana that have submitted the waivers. The others are just contemplating it or passing legislation in order to do so. Correct?
Correct.
Okay.
Yeah. Utah Idaho and Arkansas have all passed legislation.
Okay.
Arkansas has also done it through executive order. Indiana and Nebraska and West Virginia have all done it through executive order.
Okay, great. And it looks like, just for the benefit of those in attendance, it looks like Louisiana, Michigan, Montana, Texas, Tennessee have also, they are looking at proposing restrictions as well, so.
Yes, Madam Chair.
Thank you. Appreciate your testimony. Thank you. Make sure you leave a witness form. Next, in favor?
Good morning, Madam Chairwoman, members of the committee. My name is Arnie C., AC Dienoff, State Public Advocate, and I submitted my form online of staff. Okay, cool. That was a couple days ago, so I just want to make sure it didn't fall through the cracks. I'm in support of SB662. This excludes candy and soft drinks, which I think should be paid for private funds on an individual's own accord and not by taxpayer funds. I believe in high nutrition, good health, and good health leads to lower costs for our state medical system. I put this on the same category as luxury items such as seafood, high price cost of meat, some fish, some luxury items at the grocery store that cannot be bought with SNAP benefits currently. If we're going to fund and subsidize at the federal and state levels, which I believe this should be done by the private sector, by churches and not-for-profit organizations rather than at taxpayers' expense, I feel that our tax dollars should go for wholesome, good food choices. Junk food should be paid for with private funds, and therefore I support SB 662. Thank you, Madam Chairwoman.
Thank you. Any questions for the witness? Seeing none, appreciate your testimony. Next, in favor? That concludes the testimony for those in favor. Anyone here to testify in opposition?
Good morning, Chairwoman. My name is Christine Woody. I am with Empower Missouri. We're a statewide nonprofit organization. We lead a food security coalition that is made up of food pantries and food banks and other nonprofit organizations across the state working to end hunger in our state. I do want to make one clarification from what a previous testimony had said. From my understanding, it would be up to the Department of Social Services to make those determinations about which products and what details would be if this bill does pass and become law. That is not something that USDA would just blanketly make a decision for all states, which is part of my discussion of the fact that I don't think this should be done state by state. This should be looked at a federal level. The SNAP program is funded and is a federally regulated program, helping over 41 million individuals each month throughout the whole country. By making these changes just in Missouri, it will cause a lot more challenges and burdens and stigmas for not only SNAP participants, but for our grocery stores and our local economies. Deciding which foods should be disqualified and which ones should be allowed is a very difficult task. This bill pits one product against another product, making things confusing for participants and retailers. The definition is very vague, and who decides what's healthy and what's not healthy in this sort of a situation? Well, many participants, like I said, this is a federally funded program. It is throughout every state in our nation. Participants in Missouri, specifically Missouri, because we're bordered by 8 other states, participants could easily drive across the border and purchase their items with their SNAP dollars in another state where they would not be critiqued about what is in their cart, have to go through their whole cart and decide what is going to ring up and what is going to be denied. Grocery stores, on the other hand, don't have that option. Right? They will likely lose a lot of revenue and a lot of customers if this change does go through. Just looking at Newton County specifically, over $14 million in SNAP benefits were spent in that county alone in 2023 at over 65 retailers that accepted the SNAP benefit. There's a Walmart across the border in Oklahoma that's only about 45 minutes away from Neosho. It'd be an easy drive for a family to take for once a week or every every other two weeks to go and purchase all of the items that they need to support their family, not just with SNAP dollars, but other items as well that would be purchased outside of the state of Missouri. So I really want to argue that we shouldn't be limiting certain items. We need to be able to keep that dignity of choice. We need to encourage people with healthy eating and allowing them to increase their healthy food consumption by strengthening the SNAP program and strengthening other programs that really incentivize folks for purchasing healthy foods. Specifically, there's already 4 programs in place in the state of Missouri that are doing that and have been proven successful. So I really think supporting them and increasing funding for those programs is the best way to incentivize nutritious eating. For example, the Double Up Food Bucks program, the Seniors Farmers Market program, the WIC Farmers Market program, and even the very successful SNAP nutrition education programs that are throughout the entire state of Missouri that are really encouraging, incentivizing nutrition instead of restricting and limiting. And I'd be happy to talk about any one of those programs and how you all could support them more fully instead of restricting options. So I really think instead of policing grocery carts, we really need to focus on solutions about expanding access to nutritious and healthy foods for our most low-income seniors, our most low-income families in the state of Missouri. So I'm really asking you to please do not pass this bill through this committee. Thank you. I'm happy to take questions.
Any questions?
Thank you, Madam Chair. Appreciate your testimony. Thank you
Sure.
for being here today. Wanted to visit with you a little bit. I want to make sure I understand something of what you had to say earlier. Did I hear you correctly that you think that this decision should be made at the federal level?
It should not be made at the state
Shouldn't-
level.
Should not be made at the. So
It
you
should
said
not
it
be
should
state
not.
by state. It
Does
makes things very confusing.
does the USDA have authority to make a decision like this at the federal level?
I mean, the whole SNAP program is regulated and set up through the Farm Bill. It's set up through the state level or through the federal level. It's run through USDA. All of that is regulated on the federal level.
But what this legislation seeks to do is make a request of the USDA that certain items will not be covered in Missouri. For
Yes.
Missouri, for people
This would
that-
be allowing Missouri to submit a waiver to the USDA.
Okay. All right. And other states are talking about this as well. So this is a conversation that is taking place. A lot of folks do see a problem here, and we're trying to deal with it, and I want to make sure that we deal with it in the right way. So I thank you for your insight there, and appreciate you being here, and appreciate your testimony. Thank you, Madam Chair.
Any other questions for the witness? I just want to make a couple comments. It does look like under 7 CFR 21271.2, the USDA does define eligible foods. So that is a definition. Those are defined by the USDA. And it's interesting that the definitions are very similar to what is in this legislation in regards to candy products. Candy is defined as products made with sugar, honey, or other natural or artificial sweeteners. So I'm almost similar to what the definition is in the legislation. So I just wanted to point that out as well for the benefit of the committee. So appreciate your testimony. Thank you. Next in opposition.
Madam Chair, committee, thank you for letting me speak today. My name is Kim Buckman, and I represent the food banks in Missouri. So I am with Feeding Missouri. We are the largest charitable response to hunger in the state. Our extensive network consists of the 6 regional Feeding America food banks. We cover every single county in the state of Missouri and the city of St. Louis. We work with over 1,200 community and faith-based partner agencies to address hunger and to improve access to nutritious food for nearly 925,000 Missouris facing food insecurity, including 250,000 children. And yes, the state stat is 1 out of 5 children are facing hunger. Feeding Missouri opposes the proposed provisions in Senate Bill 662. While the intention of this legislation is to improve health outcomes, it's commendable and it aligns with our own mission at the food banks to enhance access to nutritious food for our neighbors that are facing hunger. We believe that Senate Bill 662 could lead to several unintended consequences, and so we want to bring those to your attention. They could worsen food insecurity. Again, food insecurity is known to cause a litany of health issues, much more than just the consumption of sugar. For low-income households that rely on SNAP benefits, including the 418,000 seniors, children, veterans, adults with disabilities. Improving the consumption of healthier food options is undoubtedly a worthy goal, but defining what constitutes healthier is complicated and not one that we think is an efficient use for us to get into. The broadness of the proposed definition of candy is an example of the difficult legislators will continue to face while trying to create universal definitions for an ever-changing market that participants and retailers might not easily understand. The vague guidelines and difficulties in defining them put us at risk of eliminating access to important nutritional sources for many individuals, including granola bars or protein bars, others that might qualify as candy, but somebody might deem as healthier than, some of those bars that include like allergy-friendly items. Again, for parents that are struggling with that, and again, just trying to feed a kid or get enough energy to sustain your daily activities. Additionally, the legislation does not effectively address the real issues at hand, which is food access and food affordability. Many rural communities fall within one of Missouri's 100 food deserts. I am including a map of some of those food deserts in with my testimony. They have limited access to affordable and nutritious food in general. As a result, many residents rely on convenience stores. They rely on corner stores. They rely on smaller retailers where options can be very limited. And again, gets into the, is it over-processed? Is it this? Do we really want to define that when that's all they have access to? Restricting what they can purchase with their SNAP benefits essentially denies them the ability to procure items that may provide them with just enough energy to get by until they can afford to travel to a location with more options, which in some cases may be an hour away and potentially forces them just to go without. The proposed measures would not only impact participants of the SNAP program, but they could also have broader implications for the economy and the accessibility for all residents in rural communities. These areas already face significant challenges in retaining retailers, and they make it more difficult for small businesses. To make it more difficult for those small businesses could exacerbate this existing hardship where we're already fighting to get food in locations and are having to do mobile distributions just so somebody has access in their communities. The potential loss of these retailers would reduce access to essential goods and services and further complicate the economic landscape for everyone living in these areas. Rather than imposing vague restrictions that may create hardships for individuals and small retailers, we urge the committee and state leaders to adopt effective evidence-based strategies proven to promote healthier choices and have meaningful impact on both recipients' health and the future of health of our small businesses. Thank you for your time and consideration, and I'll accept any questions.
Just a question, do you know how much soda and candy is given out in food banks?
How much soda? It depends on the food bank and some of the food pantries. We have a commitment through the Feeding America Network that we are trying to do foods to encourage. So we have a list of foods to encourage, which we try to acquire. I will tell you right now that is getting very difficult to adhere to those guidelines as more retailers are going out of business. Or have fine-tuned things. We are rescuing less food. We're having to procure more food. The costs that are affecting families are also impacting the food banks, and so we're struggling just to get enough food to feed everybody that's facing food insecurity.
So it's an interesting conversation because as we talk about a lot of broad spectrum issues in this committee, one of them is mental health and health in general. And so it's interesting that I would really like for somebody to define what what is the definition of food? And so is it candy? Is it soda? What nutritional values are there in soda and
so
candy?
the fact that you're very educated and I'm educated, lucky, ish educated. But I will say when you are facing hunger, when you are regularly trying to get enough energy in your system to go day to day to work, that is something that is a constant struggle. And so we were asking, as we are educated and employed and fortunate in that, we are asking for people who are regularly struggling to make sure the lights are kept on, that they can afford their medication. We're asking them to be able to make better choices than we ourselves are. If anyone in this room hasn't stopped at a convenience store and bought something that probably wasn't on the healthy list item, I'd like to see them like stand up right now.
And I don't think anybody's trying to say that you can't stop at the grocery, the corner
Yeah.
market and buy something.
It's
But
just
is it okay to use taxpayer dollars? It really has no nutritional value. I mean, you have to ask that question. And I think that's what the senator's intention is to say, okay, if I have to, there's orange juice in a lot of those convenience stores. There's smoothies. There's all kinds of more nutritionally based drinks, beverages, and food.
Somebody would get into the argument that orange juice is loaded with sugar and most of the nutritional qualities have been taken out and then added in. Setting the precedent that we're having a conversation about this on a state level instead of the federal level, which, by the way, the USDA attempted to look at this information. The data was collected in 2011, then it was published in 2015. Since then, a lot of these incentive programs that encourage healthier, that have been proven to help, those have come into place since that data that everyone keeps referencing was put into play. So in their proposal, they said it was too difficult to outline what is and what isn't healthy. And then again, if you have a committee that's like looking at all these different things, what they came up with was instead we're going to incentivize and make it easier to make healthy choices. One of those was that they were going to do encourage a little bit more, do like a basket study with the Thrifty Food Plan, and they kind of looked at that and said, okay, so for people to buy healthy items, non-processed items, less sugar items, they need more money. And since then, there's been conversation on the federal level about cutting that. So again, we keep talking that we want people to be healthy, but we're putting up more barriers than not. And I know this seems like a simple thing to do, but you are asking DSS, that's already overwhelmed, already having trouble processing applications for Medicaid, for SNAP, and all those other things, to take on another role where they're like trying to define what is and isn't allowed rather than doing it on the federal level. The federal level just makes more sense, but the federal level had said at one point that it's not feasible. It's difficult, especially with all new items coming in all the time.
Okay, I appreciate the conversation.
Sorry. Any other questions?
Yes, Senator Nurnberg.
Thank you, Madam Chair. Hey, just a real quick question on, you mentioned some of the programs that have been very helpful in getting more nutritious food to families, including Double Up Food Bucks. What were the other programs, some of the farmer market programs that we've been able to use?
There's a couple of programs that help. The Double Up Food Bucks is at the farmer's market, but also in some retailers.
Okay.
The WIC program has the Double Up bucks at the market. Seniors have Double Up bucks at the market. And then there's another program called GusNip, which is a produce prescription program.
Okay, thank you, appreciate it.
Mm-hmm.
Any other questions for the witness? Seeing none, thank you. Thank you. Next in opposition.
Good morning. Sharon Gowie-Jones here on behalf of the Missouri State Conference of the NAACP. We are opposed to this bill for two reasons. One is the larger human dignity principle. One of the main values of the NAACP is dignity for all humans. And taking away a person's choice of where they can shop and what they can buy erodes that dignity. And so that's the principal reason. The more practical reason is this bill isn't happening in a vacuum. This bill is happening after decades of redlining, after decades of building interstates that divide black neighborhoods from commercial centers, after decades of Dollar General moving into areas and displacing locally owned grocery stores with places that sell prepackaged, prepared foods and not fresh foods. So if we were just having a discussion about what should people eat, which I think is what a lot of the discussion has been, then we should discuss what everyone should eat, right? Yes, we all should be healthier. Yes, we should all be looking at how to maximize benefits that are provided by the state for people in our social safety nets. But that's not what we're talking about. What we're talking about is, if we do this, will people be able to buy food, period? Will people be able to get groceries, period? And I think that, to your point, Senator Carter, that the USDA currently has a definition of candy that is inclusive of what is considered food, right? It's not an exclusionary definition. And when you're making an exclusionary definition, you have to be much more careful so that you're not excluding things you don't intend to. And while this is, early, I think, in the process of having this discussion, I think we're running into a place where under these definitions and under the definitions that I think they're mirrored off of federally, you can buy strawberry milk, but you can't buy ocean spray. So I think there's a lot more to discuss here, and I think that as we're doing it, we should continue to realize that we're not talking about it in a vacuum. We're talking about it in a real world context, not idealistically, where you've got these folks that are going to be living in food deserts that are not just in the urban areas. I'm sorry to go on so long, but we recently did a major effort in conjunction with the LDS Church in Southeast Missouri, where we saw over 1,000 families were suddenly without jobs because of the closure of the Tyson plant and the Magnitude plant. And we had to work with the food bank to truck things in to some of these small towns where the only place to buy food was a place that was, a convenience store. So we're not talking about what the best choice is. We're talking about folks that don't have choices. And what are we doing to help those folks? So if we want healthier foods, then I agree with previous witnesses, we need to talk about how we get healthier foods in those communities and not restricting individual choice in order to try to force that discussion. So with that, I'm happy to take questions.
I just have a comment. Does Idaho or Arkansas have rural areas, these other states that are looking at doing this? Do they have rural areas and food insecurities and...
They do, and I think they're going to find out it's a huge problem if they go all the way through with this.
Interesting. Okay. Any other questions? Thank you.
Thank you.
Next in opposition.
Good morning, Madam Chairwoman Carter. My name is Sally Hargis. I live in Springfield, Missouri. I'm a mom. I'm a grandmother. I'm a grocery shopper. And I'm also a business owner. My business is Ozarks Coca-Cola in Springfield, Missouri. We serve the majority of the lower half of Missouri, and we have for 3 generations. I'm third generation in my family to help take this business forward. I care deeply about the health of my family. I care deeply about the health of my grandchildren and that they grow up making wise choices. I want that for them. Hopefully, they will never be in a position to be on a SNAP benefit program. I care deeply about the health of my community. I serve as the chairman of the board for a hospital system in southwest Missouri. I'm a public servant in Missouri. And what I've used throughout all of these roles is common sense. That's how our business has grown. That's how our business will now be transferred to the 4th generation. And we use common sense every day. Yes, adult obesity is up 37% since 2000. Full-calorie soda sales are down by 29%. Beverage calories per serving are down by 42%. So it's obvious that what we're selling, considered as soft drinks, are not causing an obesity problem. 60% of what I sell has 0 calories, has hydration benefits that generally the general population find to be beneficial. Pedialyte is not something I sell, but Pedialyte is beneficial. I do sell 0-calorie hydration drinks used for sports drinks contains electrolytes and such that families find beneficial for growing families. There's no evidence to support the claim that SNAP restrictions will improve health. There's a general assertion that there are 2 guilty categories, soft drinks and candy. The government needs strong allies with innovation from industry, and that's what we provide, continuing to innovate and be allies in solving the problem that this bill attempts to solve. Restrictions will allow bureaucrats to decide what's healthy and what's not. It's well-intentioned, but it smacks of elitism. I don't want to be accused of telling someone else how to live their life. I didn't choose in November to create larger government and more restrictions on business. I'm a conservative voter. The unfounded reputational impact to our business and follow-on risks like that of taxes is most concerning to me. Plus, you're increasing the role of government, you're regulating Missouri businesses, increasing taxpayer dollars, and reducing the efficiency and effectiveness of our state government. Even experts agree that there will be no positive effect. Even if soft drinks were to blame for health problems among SNAP recipients, and even if you could define soft drinks in a workable way, this won't stop people from buying the things that they want at the store. So it's all cost and no benefit. Using government to beat my business over the head without proof of any positive outcome. Yes, it's true that Governor Sanders intends to file a waiver. I've seen a draft of that waiver. She's created a bandwagon that some states are following like lemmings. Missouri has no reputation for following. We should lead the work on the complex problem of obesity with industry as allies and community partners. It's an opportunity for Missouri to be transformational, to decide how much of a priority the health and welfare of our entire population really is for Missouri. There's an uncertainty of definitions. Technically, USDA will not decide the definitions that will be contained in the waiver should Missouri file one. They are technically pilot programs, and they must have measurable outcomes. At this point, we do not have a way to define what a measurable outcome will be. Arkansas has a much different situation economically. Yes, it is rural. And yes, the governor used executive order and decided not to take her position through the legislature. There are different motivations in play. I thank you for your consideration and hope you will consider the effect to businesses and my 900 employees as you make your decision on this proposed bill.
Thank you.
Happy to answer questions.
Just a question I have. Are you under the impression that we're trying to ban soda and candy?
The reputational effect of what this bill does makes a very huge impact on the company that I own. Yes, I do feel like if you're banning certain people from buying our products, you're certainly sending a message to everyone that our products are unhealthy. That just can't be said generally.
Okay, thank you. Can we use SNAP benefits for cigarettes or alcohol?
SNAP benefits cannot be used for cigarettes and alcohol. But there's no correlation between the products that I manufacture and sell and cigarettes and alcohol.
Is alcohol not a beverage? And are we not limiting their choices by limiting what beverage they can choose to
Certainly,
use with their
those
SNAP
categories
benefits?
are excluded.
Okay, thank you.
Thank you, Madam Chair. Thank you for being here. Thank you for your testimony. Did I hear you with Ozarks Coca-Cola?
I am,
So
yes.
I love the product, by the way. But when
Doesn't feel that way.
I do, and I don't use Coca-Cola as something. I don't view it as something nutritional. I drink it because I enjoy it, and I use my own money to purchase it. And so I think what this conversation needs to revolve around is, if I ask taxpayers to purchase something for me, that's quite a different thing. So I also had a question about the 0-calorie beverages.
Right.
I don't know much about those. You can probably tell by looking at me. Do they have any nutritional value?
Nutritional value isn't well defined. Obviously, sugar has nutritional value because it has its energy. So it's very difficult for me to, and will be very difficult for a new bureaucracy in Missouri to define what's good and what's not good. What might be good for one person or fine for another might not be the best choice for another. So I think asking me that question just proves the point that bureaucracy is not set up to decide what's good for one person and what's not good for another. And the USDA won't make that decision.
Okay, well, I mean, I appreciate what you're saying there, but we're in a situation here where we do, and when I say we, I'm speaking, government has to make a certain amount of decisions with regard to what items are able to be purchased with this program, and already some items have been excluded from that. Cigarettes and alcohol have been mentioned, and we have to do that because we must keep in mind when we're doing this that we are not limiting folks and saying you cannot purchase this item. We're saying you cannot force taxpayers to purchase this item for someone else when the taxpayer may have a real problem with their dollars going to purchase something that's supposed to be nutritional that is not.
Sure.
So I want to make it very clear that's kind of what my position is. Still love the product.
Sure, thank you. Sure, I get that, and I get the taxpayer dollars. The problem is we all should be concerned about how taxpayer dollars are spent, and this will increase the number of taxpayer dollars that need to be spent to oversee a program like this.
Well, I appreciate your testimony. Thank you for being here.
Any other questions?
Yeah, Senator Nicola.
Thank you, ma'am, very much for your testimony, and Madam Chair, thank you. And I'm just going to echo a little bit of what my colleagues have already said after sitting here listening to the testimony that we've already heard. So I'm for one would never want to limit anybody's choice. I'm a free market person. I think people need to, if they want to drink as much of your Coca-Cola or whatever product you have that they want to, they're free to do so. But the issue that we have here too is this program already does limit certain things. Government limits things on people all of the time in many other areas. So we're not taking people's choice away because, like my colleague here to the left mentioned, we're talking about my money and your money, and it's not government money, it's taxpayer money on what we want to agree to help, because it's not only what they're eating, it's any health benefits they have, because then we're going to have to pay for that too. So this is not just about limiting things from SNAP, but it's also got long-term consequences. And government does this all the time in many other areas, because we do have a limited, unlike what our federal government has been doing by printing money, we do have we have a limited amount of resources. And we're being taxed to death everywhere. And for me to pay taxes and let people just do whatever they want with that is really unacceptable. And but I don't want to limit people's choice. They can go take their money and go buy whatever they want and eat whatever they want. That's up to them, and they have to pay for the health. But when it all falls back onto us, then we do have a problem. And that's really what I think the senator's bill is about, and what we're looking at. What is best for the people, our tax dollars, and then the long-term consequences, health consequences, that is also the taxpayers are going to have to pay for.
So how will we know if it works? How will we know if SNAP beneficiaries who are on average on the program for a year get any long-term benefits by placing these restrictions on them?
How do we know that there's benefits from not having alcohol or cigarettes?
Well, the two don't.
Well, we're
run in any
limiting
kind of
their
parallel.
choice. We're limiting their choice. And I think there's plenty of studies out there, I've seen them, that healthier food choices is better for people. Diabetes, for one, and all kinds of different health benefits that people have from eating healthy. Our bodies are created to, food is actually a drug, because it can change the chemical contents in our body. So our bodies are designed and created to function with certain nutrition. And we have, I've worked in the school district before, and I've seen kids not getting nutrition. They have a very difficult time concentrating, thinking, working, and a lot of it goes back to nutrition. Nutrition is a cause for a lot of sicknesses and a lot of diseases. And this is a much broader conversation to get into. And so what's before us today is the senator's bill. Do we need to keep, with our tax money, keep paying for sodas and all of these things that have health consequences? And we do know, there's studies out there that we do know have consequences on this. So for me, after listening to everybody, I don't see the argument that's convincing me that we need to step back from this. Because one, we're already limiting it, right? Cigarettes and alcohol, at least for 2. And then also we have some long-term consequences of health. So anyway, I thank you for your testimony.
Yeah,
too.
and I
Appreciate
do
it.
appreciate your comments about long-term health. I'm all in for that. And I believe that industry, especially my business, can be a partner in figuring out better ways to ensure long-term health and make certain that encouragements are there for general population to be healthier.
Any other questions for the witness? Seeing none, thank you for your testimony.
Thank you.
Next in opposition. You got to sit closer.
Yeah. Sorry, I beat you. Katie Campbell here on behalf of the Missouri Beverage Association. I'm going to try really hard not to cover anything that's already been covered. I just wanted to touch on why I think the definitions do matter. It goes back to what Sally just said, which is we call it a waiver. It's technically a pilot program. And so, when the department submits a pilot program, we want to make sure that we're determining what the definitions are in Missouri and not letting DC do it. And I think that when you submit the pilot program, then the FDA looks at it and, reviews it and says, yes, we approve of you trying this pilot program or not. And so, along with that, I think concerns about if your family's on SNAP and you're a high school athlete and none of that is up to you, your family situation, but your family can't buy you Gatorade for after practice versus, I was looking at the vending machine downstairs and you could buy, there's the new Monster energy drinks that have coffee in them, but because they have milk in them, you could buy those. And I don't think that's the intent, but it's just an example of why I think working on definitions is important so that, we're covering what we want to and making sure if there are things that we want to allow people to use, that they're allowed to do that. Another point is that there are 22,500 veterans on SNAP, which I think is really unfortunate. But I do feel like we should allow our veterans to have some choice. So, they fought for our country. I feel like it's the least we can do for them. I know that we're talking about health, and I'm not saying that every veteran should have soda, but maybe they should be able to have, 0-calorie Gatorade. And then lastly, no one touched on the fiscal note. There is a $15 million to $30 million fiscal note. It's specifically because that's what the software company that we currently use for our EBT program, it's what that would cost to upgrade it because we currently don't have the ability to kind of delineate amongst food. And the reason for the 15 to 30 is it's $15 million for the state if that we get like the federal match. Because it's a 50-50 program. If we don't get the federal match, then it's up to $30 million. And so I just thought that was an important piece to touch on, considering we've seen what upgrades to software have done for the budget process. And I just want that kind of on the forefront as we're thinking about this. It will require a software upgrade, which can come with its own disadvantages. I don't know that that's, a reason to support the bill or not support the bill, but I think it's just something that we should consider because I'm a very detail-oriented person, and so I like to think of all the unintended consequences. And so, we stand in opposition to the bill. I'm happy to answer any questions, and thank you for your time.
Thank you. Just a couple questions I have. So I've heard in testimony today in regards to the bill, both sides of people expressing their concern, whether it's DC. On one hand, we're hearing DC needs to be the one to determine this, and on the other hand, we're saying the state needs to be the one to determine these definitions. I think based on based on the conversation that the senator has already expressed, he's willing to work on those definitions. So I would hope that would alleviate one of your points of concern, is the definition. Another one is, as far as the veterans, Senator, are you a veteran? Yeah. Okay. So I don't think that. Again, well expressed, nobody's trying to take away access to something a veteran is wanting. I just don't even know that that's a concern on the table. But then I do, with the third point, want to just express that I don't know that we have the ability to maintain the largest increase in the state's budget with Medicaid continuing to have those costs burdening the state. We have to start looking at broader health issues and how we might be able to help people be healthier. I mean, if you look at it, it is the number one budgetary expense. And so while I do see that software might be expensive, and the long-term goal, what are we looking at as far as mental health, just overall general health for the citizens of the state. I just think that needs to be part of the conversation in the equation when it comes to looking at broader budget issues. So just wanted to share those concerns. Any questions for the witness? All right, seeing none, thank you. Next, in opposition.
Madam Chairwoman, members of the committee, bill sponsor, thank you for allowing me to be here today. I'm the executive director for the Missouri Grocers Association. I'm also speaking on behalf of the Missouri retailers today. I think it's great to have this conversation. We've been having this conversation in Washington, D.C. as well with our national association and all the other players in this industry to figure out what is the best route going forward. This, I believe, should be done on the federal level. It creates mass chaos at our retail locations if we do this state by state. The definitions the senator has included in here are identical to what was passed in Kansas and vetoed by the governor. I believe it's very similar to the ones that were given in Arkansas and Nebraska. And that's a good start that they're similar. But what the waiver is asking for is a waiver from the definitions that the USDA has created for the SNAP program. The waiver is not saying that we'll all use the same definitions. So state by state could be different. Ms. Gamble mentioned the cost to implement the differentiation of whether it's SNAP eligible or it's not. Right now, we currently use the USDA definition, which also applies for our sales tax. And those of you who are around during streamlined sales tax, you may remember people bringing Snickers and a Twix candy bar around and asking you which one was food and which one was candy. And I would say most of you got it wrong. The Twix, by the USDA definition, is considered the food, not the Snickers. And licorice is considered food by the USDA definition because they have flour. Those are important definitions to our front end. If you're in Kansas City, St. Louis, Hannibal, St. Joe, Joplin, any of these bordering states, you have people constantly switching sides of the state, purchasing where they can go one place to purchase all their needs. No one likes going to 20 different stores to get what they need for the week. One, we don't have time, and it's just a pain. So people go where they can get what they need one time. I think we can all agree that's the easier way to shop. But if I can't get what I want and I have to cross state lines, but then all of a sudden their definition's different, it creates great chaos and creates pressure on our front end people to make sure they handle that situation so it doesn't escalate. Oh, you can't buy that here. Can't buy that at this store, but the same name store a mile down the road, you can. Because it's not going to keep recipients of SNAP, Missouri recipients of SNAP, from buying candy and soda or soft drinks in other states. It's only going to prevent those sales in the state of Missouri. Several of our retailers, big and small, are omni-channel now. You can buy this stuff online. And it can be delivered at no extra cost. And SNAP doesn't allow for a cost of delivery anyway. But if you're having something delivered, if you order something on Amazon, that's SNAP eligible. Can you do that? Those are the questions we have to ask before we rush and pass something like this. I appreciate the conversation. I think it's something we continue to do. Over the years, we have changed our position federally. It used to be, it was, no, we're not doing this. Now we want to be a part of the conversation because we understand the pressures of you all. We understand the pressures of the recipients. And most importantly, we understand, the Grocers Association understands the retail implication in their stores and what it means. And we want to be part of the solution and not part of the problem. And my last thing that I would add is, you know, we have a different administration now. I think they'll do something federally. The previous administration tried to do this very much, or a couple administrations ago, tried to do this through a lunch program by only allowing healthy things to be on a school lunch program. And we thought that was the craziest thing in the world. The Obama lunch program was horrible. We all said that. Now we're wanting to take it out of the school, maybe put it in our homes. I'd be very careful how we do this. I'm open for discussions. The grocery industry, the grocery owners in your districts, the ones who have left your district because food deserts, we want to be a part of the conversation, and we welcome that conversation. And thank you, Senator, for your service. I, as a veteran, I probably learned how to drink more soft drinks in the service than coffee because our coffee was horrible in the Air Force. You guys may have had better, I don't know. But thank you for your service, and I'll take any questions.
Yeah, no, just I'm grateful that you're willing to have ongoing conversations. So I would assume that you're going to be visiting with the senator and trying to come up with a resolution. Again, the tug of war between whether it's federal language and I recognize that the definition of flour is the determining factor in what candy bar you use.
And absolutely no one knows that unless you're a nerd like you and I who go in and look at that stuff.
Right. No. And so again, answering some of these questions are important questions to have. Again, I don't see at a 3,000-foot level where this discussion, we're not supposed to be, states are supposed to be independent of each other. We talk oftentimes in this committee about reciprocal agreements between practices of doctors, lawyers, all kinds of things. And so we need to continue to have the conversation. So again, appreciate the senator for bringing this forward. Look forward to you working with him on
Absolutely. I enjoyed sitting behind him when he was in the House.
Awesome. Thank you. Any questions for this witness?
I remind you, we go by the mantra of we either sell it or smell it. So if the consumer wants it, we're going to have it in our stores. If they don't, we're not going to have it. So,
right. Thank you.
Thank you.
No further questions. Next in opposition.
Thank you, Madam Chair, members of the committee. Jared Hankinson with the Missouri Chamber of Commerce and Industry here to speak against Senate Bill 662. I don't want to belabor the points that have already been made that you have heard, but do want to add some additional emphasis to a couple of things that we have heard from our members across the state. You have already heard from many of the previous testimonies the concerns around the breadth of the definitions here, a variety of food items that maybe we wouldn't necessarily classify as candy or soft drinks that might be worked into those definitions. Obviously, we and our members have some concerns with that, as you've already heard, and we look forward to the discussions with the senator to figure that out. The other thing that I really want to emphasize is something that you heard from Ms. Hargis, actually. What is the message and what are the negative implications for industry and for employers by making a decision like this and placing a heavy burden from government onto employers and onto businesses? Does moving this legislation forward create a narrative that Missouri is not a state that is friendly to business, where the state of Missouri is now attracting less jobs and we're generating less economy in the state of Missouri, and maybe we have more individuals that have to consider using the SNAP benefit because of a lack of access to gainful employment and things like that. So I do want to make sure that we are thinking about the message that the state of Missouri is sending to industry and employers across the country when they're looking to come do business in the state of Missouri, or if it is an existing Missouri employer looking to maybe grow in this state. If you are on the border of the state of Missouri, maybe you decide to grow into Kansas or grow into Arkansas, and I think that those are things that we need to be aware of those concerns as well. So again, we'll not belabor points that have been made. We agree with the opposition testimony to this point, and I'm happy to take any questions.
Thank you for your testimony. Do you think that business owners are concerned about the health of their workers?
Can you say that again? Sorry.
Are businesses concerned? I mean, when I talk to businesses, one of their biggest hurdles is people not showing up in the health of their employees.
I think businesses are absolutely concerned about the health of the employees. Businesses care about their workers. Businesses care about their workforces. We see there's a huge push of, mindfulness and sustainability in workplaces, giving people the time to go for a walk or have time to go to that doctor's appointment or things like that. So I think it certainly is a concern of businesses. I do not think that the provisions within this legislation are accurately addressing those concerns of businesses that might have concerns about the health and welfare of their employees.
I just want to reiterate that this isn't a ban on any food product. This is just basically taxpayers paying for those things that seem to not have very much nutritional value. So
understood. Yes, ma'am.
Any questions for this witness? Seeing none.
Thank you very much.
Next in opposition.
Good morning, Madam Chair, members of the committee. Jackie Barget, registered lobbyist here on behalf of the Missouri Petroleum and Convenience Association, which is the gas stations and mom and pop convenience stores across the state. I will keep my testimony short. A lot of our opposition kind of aligns with Mr. Schall's comments and some of the concerns Senator Nurnberg mentioned earlier around the broad definition. So we're very excited Senator Brattin is willing to work with us on that. I will say, I know it has been harped on, but just to note, our retailers would prefer it to be the rules and regulations to be regulated by the federal government, just to create a level playing field along the state borders.
Okay, awesome. Any question for the witness? Seeing none, thank you. Next in opposition.
Good morning, Matthew Smith with Associated Industries of Missouri. Just going on record in opposition to this bill. Don't want to take much of the committee's time and don't want to belabor the point, but we're here specifically because of the administrative costs that would increase on private businesses, particularly small businesses, if this were to pass. So with that, I'd be happy to answer any questions.
Thank you. Any questions? Seeing none, appreciate your time. Is there anyone else here to testify in opposition? Thank you. Anyone here for informational purposes only? All right. Senator, any comments, closing comments?
Just briefly, as we heard in testimony, they will follow the market. And if these products are outlawed from taxpayer purchase, they will then stock their shelves with items that are. So it will be a healthy initiative, putting forth healthy food items that will make it to your convenience stores in these food desert places, other than these junk foods that have no nutritional value. These beverage manufacturers can sit here and play very coy, wordsmithing as to not knowing that these beverages are unhealthy and provide no nutritional content. But give me a break. Let's look at the test case of America in the proliferation of all these food items on our shelves, how they market them. They know they're marketing to people and to this industry and to this taxpayer-funded program. They know that. It's really frustrating. I just hate to see the line out the door to move us towards a healthy state. And that's exactly what this is intended to do. This isn't to limit anybody's capability with their own pocketbook. This is ensuring that we aren't funding the demise of our children and generations to come with unhealthy food purchases that we know are the number one purchased food items. I mean, this is not rocket science. All of these retailers have the systems already in place that will limit. We've all seen it at the grocery store. If they have something, if somebody has the EBT card, that they're denied and it's already in the system. The system already exists. So this testimony that it will cost millions and millions of dollars to retool everything is just an absurdity. And it's a mischaracterization of what their capabilities as a business is. So I'm not trying to belabor the point, but this is something that we have got to do. Our kids are depending on us to make these right decisions with taxpayer dollars. So thank you.
All right, we look forward to hearing, Senator, the conversations as they move forward with all of those who express concern. So thanks. All right, with that, we're going to move into executive session. Can I get a second? Thank you. So I'm going to make a motion to bring House Bill 195 relating to abortion before the body. Can I get a second? Second. Thank you. House Bill 195 is before the body. Is there any discussion on this legislation? Seeing none, I move to pass House Bill 195. Can I get a second? Second. Thank you. Secretary, please call the roll.
Senator Brattin? Aye. Senator Hudson? Senator Nicola? Aye. Senator Nurnberg? No. Senator Lewis? No. Senator Carter?
Yes.
Vote of 4 to 2.
All right, by your vote of 4 to 2, House Bill 195 is passed. I now make a motion that we go to House Bill 339. This is relating to records of complaints against child care facilities. This is the bill that we heard, I think, last week. Can I get a second? Second. Thank you. House Bill 339 is before the body. Is there any discussion? Seeing none, thank you. I move to do pass House Bill 339. Can I get a second? Secretary, call the roll.
Senator Brattin. Senator Hudson. Senator Nicola. Senator Nurnberg. Senator Lewis. Senator Carter.
Aye.
6-0.
Okay, by your vote of 6-0, House Bill 339 is due pass. I now make a motion that we bring before the committee Senate Bill 598. This is relating to the disclosure of vital records before the body. Can I get a second?
Second.
Thank you. Senate Bill 598 is before the body. Is there any discussion? Seeing none, thank you. I move to do pass Senate Bill 598. Can I get a second?
Second.
Secretary, please call the roll.
Senator Brattin. Senator Hudson. Senator Nicola. Senator Nurnberg. Senator Lewis. Senator Carter.
Aye.
6-0.
Okay, by your vote of 6-0, we have due pass Senate Bill 598. I make a motion that we move out of executive session. Can I get a second?
Second.
Thank you. I now move that we adjourn our Senate Committee for Family, Seniors, and Health. Can I get a second?
Second.
Any opposed? All right, thank you.